what purpose we are caring the bedridden patients? How it is important for that care of the patient. So first one is prevent health complication. If the patient is bedridden, to prevent the further complication, development of the further complications, and promote comfort. So if the patient is bedridden, the activities are all activities are diminished. So promote the comfort of the patient by applying proper care with confidence and prevent isolation. If the patient is on bedridden condition, he or she is fully isolated from the common community. So we have to give a proper care and monitor the patient in a proper way. So the isolation may be preventable. So next one is improve the quality of life. These are the main principles of the bedridden patient. Next one is what are the basic need of a patient? All of you know what are the basic needs of a patient? Basic needs. So mainly basic need means food, water, hygiene, shelter. That are the basic need of a person. In our patient side, if a patient is bedridden, the basic need are oral care. How to care the patient? So oral care is the first one. Second one is skin care, eye care, ear and nose care, hair care, perineal care, and nail care. These are all the nurses can know about these cares, because in the fundamentals of nursing, in first opinion, dealing with the care of a patient, including these main cares in the fundamentals of nursing in a head to foot care. So we have to clear about that. So we can go through in detail. Oral care is overall health is same. So once we have to give a oral care to the patient, this will maintain the overall health of the patient. So what is the purpose of oral care? So mouth is an excellent incubator for growth of bacteria. In the mouth is a reservoir of growth of bacteria. So hygienic practices help to maintain healthy status of the mouth, teeth, gums, and lips. So we have to clean the mouth properly. It will prevent the incubating the growth of bacteria. So how to we can remove the food particles from our mouth in proper manner. Remove the food particles that may be likely medium for bacterial growth. So we have to remove the food particles to keep the lips and mucosa soft, clean, intact, and moist. Promote the comfort. For this purpose, we have to maintain the proper oral care. And improving nutrition status by enhancing appetite. Stimulate the blood circulation of gums, thus maintaining healthy firmness. Eliminate the sources of unpleasant odor and prevent dental caries. What are the common oral problems? Anybody? The common oral problem. mainly dry mouth, painful mouth. Mainly the painful mouth is followed by the dry mouth because the dryness may cause the painful gums and painful oral cavity. So halitosis. What is halitosis? Anybody? Foul odor. Maybe because of the accumulation of the food particles in the gums and in between the teeth, it may cause the bad odor. So the patient may very isolating from the others because of this malodor. The next is candidiasis. This is nothing but oral fungal infection, maybe because of disease condition, any other dry mouth, any other medication, maybe because of bad oral care. Next one is oral mucositis and alteration in taste, excessive salivation. These are the common disease conditions in the poor oral care. What kind of patients needs oral care? Or who needs oral care? We know everybody needs oral care. So especially in disease condition and some common patient may very careful to do the oral care. So terminally ill patient, unconscious patients, patients breathing through mouth, post-operative patients, patients with infections and disease of mouth, patient on NG2. In terminally ill patients and some in family members very neglected to do that oral care and all because anyway they going to die. So for what purpose we are doing oral care? So there you have to educate them. There is a need of oral care. The terminally ill patient having some sort of discomfort due to the poor oral hygiene. So you have to tell them to give proper oral care to the patient. So sometimes the terminally ill patient may unconscious. So very difficulty to do the oral care. So educate them how to give oral care to the patient. So unconscious means they not sometimes they not responding means they knows what's happening surrounding. So you have to give a proper care for the patient, not only the mouth care, all care they needs. So next is patient with the breathing through mouth because the mouth is open means there is a dry mouth will be there. So we have to do the proper oral care. Otherwise, it leads to the other infections. So next one is post-operative patients, patient with infections and disease of mouth. In disease of mouth means any oral cancers and there is so much of secretions are there. So you have to do the moral care and remove the secretions then and there. Otherwise, it also cause the malodor and higher infections. Patients on nasogastric tube. For what purpose we are doing oral care for the NG2 patients? They were not taken anything orally. So for what purpose we are doing oral care for the nasogastric feeding? Anybody? So NG2 patients, sometimes patients are conscious, sometimes may unconscious, but they knows what's happening in their own surroundings. So you are giving any feeding to the NG2. First, you have to explain them what are you doing going to do, or what thing you have to feed them. So some sort of some drops you can give through oral for the identifying the taste or identifying the food. So and also there is a some dryness is there, so you have to give the proper oral care, and secretion will be there, so you have to remove the secretions from the mouth, and full some sort of dust and some death cells will be there, so you have to remove through the oral care, and you have to apply some moisturizing cream to the lip center. So while doing oral care, you have to assess the oral cavity properly. For what are the main assessment is, one is cracked lips, means that some sort of injured, some cracks will be in the lips. Dry or coated tongue, the tongue will be full of dust or sometimes of whitish discoloration will be there, that is coated tongue. White cut like patches, and ulcers in the mouth, any redness or bleeding, any pain in the mouth, patient may complain of dysphagia, change in taste of food, any difficulty in chewing, anorexia, unpleasant smell, medication history, and treatment history. These are the main assessments in oral care. So first one is you have to monitor the oral cavity. Properly inspect the oral cavity. Any particular assessment is there, you have to mention as proper manner. So commonly we are using the solution for mouth care is normal homemade saline or 0.9% sodium chloride solution for oral care in our setting. How to uh, uh, give a preparing the saline means 500 ml of water plus 1 teaspoon of common salt. You can boil it properly in for 10 minutes and cool it and keep it in a until covered bottle. And other options are, along with that we have to add soda bicarb. It's the combination is 500 ml with 1/4 of the teaspoon of baking soda in that, and you can use for oral rinse. It can be repeating every 6 hourly. While educating the patient, tell them to brush the teeth twice a day with a soft toothbrush. The toothpaste left in the mouth can cause dryness, so proper rinsing is needed. Rinse the mouth with homemade saline or soda bicarb. It will reduce the accumulation of food particles in between the teeth. Tongue to be brushed with a soft toothbrush. Tell them to don't use tongue cleaner like hard materials, because it may reduce the papules in the tongue. And tell them to take plenty of fluids, and tell them to pineapple. Use the pineapple. It contains some mouth cleansing enzymes are there. So it will, and also it will increase the salivary saliva production. It's a salivary stimulant. So you have to use tell them to use the pineapple preparations, and dangers should be removed at the night. If the patient is requiring any assistance means, you have to explain the procedure to the patient, provide privacy, provide a semi-Fowler's position or Fowler's position if not contraindicated, because it's a proper position for the oral care. Because if the patient is needed only assistance means, you have to tell them to maintain a Fowler's position or semi-Fowler's position, and place a towel under his chin and over the bedding. to avoid the contamination, and pour the water over the brush and place dentifrice on it. And encourage the patient to rinse his mouth frequently. Remove and clean the equipment then and there, and wash your hands. Document the time, solution, and oral condition as mentioned as above. And procedure for a terminally ill patient. How to give a terminally ill patient, give a oral care to the terminally ill patient. So in hospital setting, we can use the artery forceps, tongue depressor, gauze piece, normal saline, small Macintosh, face towel, clean water, swab sticks, kidney tray. And in home care setting, instead of using artery forceps, we can use the spoon or ice cream sticks. Two spoons are needed. One is for open the mouth, maintain the opening, and one is for the cleaning purpose. And clean cotton cloth or gauze piece. It should be covered by the gauze piece is covered the spoon. Homemade saline. We already discussed about homemade saline, how to prepare the homemade saline and plastic sheet to avoid the contamination of the that area. Face towel, clean water, swab sticks will be there, kidney tray or plastic tray to waste management. And how to give a oral care to a terminally ill patient. And first thing, anyway, you have to explain the procedure to the patient, provide proper privacy, place a small Macintosh with a face towel under the head, and give a proper position like semi-fowler's position and or supine position. Supine position sometimes maybe we can provide according to the patient condition. If the patient is in supine position or semi-fowler's position, you have to place the patient head turned towards the side to drain the fluid, and use the padded tongue blade to open the patient mouth and separate the upper and lower teeth. In home setting, we have to use the spoon. You have to place the spoon which is covered with a gauze piece. You can place the spoon in between the teeth, upper teeth and lower teeth, and give a proper opening to the oral cavity. Then you can clean in from one side to other. Soak the cotton balls in homemade saline and squeeze out the excess water, because sometimes patient may unconscious, means the so much of water will be entering into the oral cavity. It will go to the, there is a chance to go to the lungs. So avoiding this, squeeze out the excess water. Then clean the teeth, lower chewing surface, inner side and outer side first. Then upper chewing surface, inner side and outer side. Clean the oral cavity from the proximal to the distal side using one gauze piece to the each stroke. So otherwise, the contaminated things will be goes to the least contaminated area also. So you have to use the one goes for single stroke. So clean with the normal water. The patient's lips may be dry, means you can apply the lubricate the lips using swab stick. Document the time, solution used, condition of the oral cavity, any abnormalities noticed, and the patient's response. You have to, if any procedure you have to do, means you have to record it proper in a proper manner with the proper evidence. The common lubricants used for the oral care means liquid paraffin, coconut oil, ghee oil, and Vaseline. To the patient, help the patient move his head towards the edge of the bed and remove the pillow. Place the patient in the bed with the behind the. You have to stand behind the head and keep the patient in the edge of the bed. Protect the bed linen and a pillow cover with a towel or Macintosh. Insert the cotton balls into the ear. For what purpose we are inserting the cotton balls to the ear means you have the entry of, to avoid the entry of the water to the ears. Place a Macintosh under the patient's head and neck. Keep one end of the Macintosh in a bucket to receive the water. Say cone like, it will be placed like cone like. The tip of the cone will be entry into the bucket. Wash thoroughly with soap and shampoo. Rinse thoroughly and dry the hair. Braid the hair into the two on each side of the head. Remove the cotton balls from the ear after cleaning. Regarding the nail care, this is the normal procedure in nursing cares, and assemble the articles and explain the procedure to the patient. Place the rubber sheet under the patient hand or leg. Soak the fingers with warm water. It will be moist the nail and we can remove easily. It's the fingers in the warm water for 5 minutes. It's enough for moistening the nails. Cut the free edges of the nail. Encourage the caregiver to provide nail care. All nurses know all cares about that. You have to give the proper education to the caregiver. So you have to explain the caregiver regarding every care in a proper way. How to give a bed bath and what is the reason for giving bed bath. Bathing is very important in maintaining the promoting hygiene. So mainly the objective or purpose of the bed bath is to clean the dirt from the body, to increase the elimination of waste through the skin, to stimulate the circulation, to induce sleep, to provide comfort, to give the patient a sense of well-being, to regulate body temperature. The procedure is maintain privacy and explain the procedure to the patient. All needed equipment should be at the bedside and conveniently placed around the heart. The temperature of the water should be adjusted for the comfort of the patient. If the patient is conscious, you can tell them to check the water. It's be normal to them. So keep the patient near the edge of the bed to avoid overreaching the straining of the back of the caregiver. So you have to arrange the article to the bedside for convenience of the caregiver. Only small area of the body should be exposed at the bath at a time. So if you are starting with head means you have to expose the area only. Then you have to clean that area, then go to the next side. Remove the soap completely from the body to avoid the drying effect. If we keep the soap oil or soap to the particular area, if you are not forget to remove means that area will be dry. So you have to remove the soap completely. Cleaning is done from the cleanest area to the less clean area. Example, upper part of the body should be cleaned before the lower parts. So upper part of the body considered as the least cleanest area, and lower part is least cleanest area. So wash hands and feet by immersing them in a basin of water because it promotes through the cleaning of the fingers, nails and toenails. A thorough inspection of the skin, especially at the back of the body, should be done to find out the early signs of pressure. So apply moisturizing cream and massage at least 3 to 5 minutes. It will promote the circulation. And for the next one is back care. For what purpose we are doing back care means it will relieve the pressure to the pressure points and it will encourage the circulation, blood circulation. It leads to the decrease the chance of pressure sore development and give special attention to the pressure points back every 2 hourly. We already know that if the patient is bedridden, you have to give a proper position in every 2 hourly, and position changing you have to tell them to do a proper position changing in 2 hourly. And leather soap wipe is sponge towel, wipe with the soap and rinse with the plain warm water. Dry the area by patting and not by rubbing because it may cause the friction, and friction cause the friction injury like bed sores. So apply moisturizing Cream and massage at least 3 to 5 minutes. Massaging helps to increase the blood supply to the area and prevent the pressure sore. And active and passive exercise. Active and passive exercise. Active means patient can do the exercise without any assistance. Passive means the external support is needed. So the caregiver will help to do the some sort of exercise, that is passive exercise. The exercise, the need of exercise means it must be integrated into the patient daily life as it prevents contractures, foot drop and wrist drop. And all the joints needs physiotherapy to avoid the contracture. Educate the family the importance of exercise to prevent the joint stiffness. Once we are not using any part of the body, it causes the contraction. So you have to maintain proper exercise for the every joints and every part of the body. If the patient is okay to do self exercises, means you have to promote that. Otherwise, with the help of the caregiver, it should be indicated. Next one is catheterization. For what patients, in what kind of patients we do the catheter? What are the indications of catheterization? Anybody? Urine retention. Okay. Okay. Urine retention, urinary incontinence, urine incontinence, unconscious patients, bedridden patients with the incontinence. Okay, these are the main indications of the catheterization and bladder cancers like CKD. Okay, and in catheterization, the Foley's catheter is a sterile, germ-free tube that is inserted through the urethra and into the bladder to drain the urine. This is the purpose of catheterization, and we are inserting a Foley's catheter to the urethra into the bladder. And type of catheterization, mainly for type of catheterization is there: inwelling catheterization, inwelling suprapubic catheterization. Suprapubic means in lower abdomen we do a ostomy like a hole on it, and directly into the bladder. We have to do the catheterization directly to the bladder. That is suprapubic catheterization. Clean intermittent self-catheterization. In our setting, we are telling that ICC and condom catheterization. It's the external application of condom, external application of a custom-made tube is there. It will be connected to the urobag. So in urinary incontinence patients, in male patient, we can use the condom catheterization. In retention and all, we use the condom catheterization. In normal catheterization, we insert the tube through the urethra. In suprapubic catheterization, we insert to the small opening in the lower abdominal wall. And procedure, take all, it's a sterile procedure. All of you are aware that catheterization is a sterile procedure. So take all sterile precautions. Choose the smallest size of catheter if the patient is doing catheter in a first time, and lubricate the tube properly. And before that, we have to mention the sizes of catheter: 14, 16 and 18. Commonly, we are using 14 and 16. In 14, in first time catheterization, we are starting with the 14 for an catheter, and in 16 and all, if the patient is according to the urethral size, you have to put the 16. And lubricate the tube and wait. And it is important to ensure that the bulb is in the bladder, how much to inflate, and 10 ml is needed for inflation. More than 10 ml, we are not at all using for that. Sometimes it may be, if the patient is having any leak, means you have to remove 2 ml at a time. If the leaking is persisting, you can push the 2 ml again. And antibiotic prophylaxis or urinary catheterization insertion is not recommended now. So all of you know catheterization procedure. So just it's a main reminders are there. Next one is ICC or clean intermittent catheterization. Maintain privacy. Wash hands. Position according to the comfort level of the patient. Nelcat size. Normally we are using Nelcat for the ICCs. Normal size is 12 and lubricate the tip before the insertion. And time interval is every 4 hourly. Clean the Nelcat under the running water. Keep it in a dry clean containers. In the some patients we are using ICCs because if the patient is having CBD, that time they have sensation of urination or sensation of bladder filling. That time we are doing ICC. How to check bladder sensation means on a CBD patient we have to hold the tube for an hour. That time patient reported bladder sensation. So then we can remove the CBD and tell them to use the ICC. First and all, we have to do. Sometimes patient may complaining of leakage. Well, if the patient is having leakage, that time we can use the content drainage. If the patient is not at all reporting any retention, we can educate them to do the ICC. In leakage time, they can use the contact catheter. Gradually, the leakage will be decreased. What are the advantages of ICC means? It's a improve the quality of life because the CBD is some sort of affecting the quality of life because very the some of the patient is very bad to collect the uro bag and catheter with them. So they are isolated from the community. So we have to tell them to use ICC if possible. Increase the self-esteem and confidence. Easy to use. This is less expensive and reduce the risk of infection. Improves the sexual life also. This is the condom catheterization. This is the condom catheter used for the patient with the urine leakage and if the patient is having sensation, so we can use the condom catheter. The advantages are less catheter associated urinary tract infection, more comfortable than the inhaling and ICCs, less movement restriction, non-invasive and nothing is inserted in your body. So this is non-invasive technique. And disadvantage is leak if you are using the wrong size and the fit is incorrect because every condom catheter has a size according to the size of the penis. We have to apply the condom catheter. Skin irritation and breakdown of the the penile area will be happens because of the urine leakage. Every time the urine is contaminated to the skin, so it will affect the skin. More likely to fall off and leak than internal catheters. And if the soiling of the due to the urine drainage, it will affect the surrounding area. It will be fall off. Allergic reaction. Some patients may report an allergic reaction because of the latex material of condom. Next, if the patient is with a CBD or a suprapubic catheterization, the bladder care is very important. So catheter should be changed from 3 weeks to 1 month. Commonly, we are telling them to change your catheter every monthly. So provide peritoneal care. Daily we have to do the perineal care to the patient. While doing a catheterization, we are doing the catheterization properly, then send back to home. Nobody telling the catheter care and all sometimes. So we have to forget that it will lead to the main infection source. So you have to explain the perineal or bladder care to the caregiver if the patient is having catheterization, to keep the always keep the urobag closed and below the waist level, otherwise it will leads to the backflow of the urine. Empty the bag when it is 3 by 4 is full. So otherwise it also leads to the backflow, and intake of fluid at least 2.5 to 3 liters in 24 hours. Otherwise it will lead to the urinary tract infection. Observe the urine is draining freely. Any color change in the urine should be reported. So observe after the catheterization, and if any bleeding is there, any color change is there, so you have to monitor. Encourage the patient for daily bowel movements. Otherwise, the constipation leads to the urinary retention. And care of perineum. Perineum should be cleaned after each act of urination and defecation. Clean with soap and water daily 3 to 4 times and keep the area dry. Clean from the cleanest to the less clean area. Hand should be cleaned after giving perineal care. Next one is bowel care. In a bedridden patient, due to lack of exercise, privacy, reduced food intake, medication, etc. cause the constipation. Encourage patient for bowel movement daily. Give time for bowel movement. You have to maintain a daily routine. To maintain a daily routine for the patient, so you have to give the time for the bowel movement. Patient should be encouraged to take high fiber diet, adequate fluid intake, and encourage regular exercises. The bowel exercises also there. You have to encourage them to do the bowel exercises and give a maintain a proper time for bowel or bowel defecation time. And bowel care, use of bedpan. It is mandatory to maintain patient privacy and use of commode or lavatory for the defecation. If the spurious diarrhea, ask the history when it started and before the onset what was the condition. What is the spurious diarrhea? Anybody? Anybody knows spurious diarrhea? It's a watery stool passing through the rectum after a long-term constipation. This is the spurious diarrhea. Next one is the management. The for spurious diarrhea and normal constipation and all, you have to do the proper rectal examination. And if after the rectal examination, identify the rectum and check the rectum is loaded or balloony. Balloony means there is no fecal matter in the rectal cavity. If the loaded means there is a fecal matter. Identify the characteristics of the stool, and according to the Bristol stool chart, if the stool is very hard, you can remove manually. Otherwise, you can do the enema to softening the stool. Normally, we are using high sodium phosphate enema for the enema purpose. Next one is nasogastric tube feeding. It's a process of feeding with the tube, that is nasogastric tube inserted through the nose, pharynx, esophagus and into the stomach. There is a various type of tubes are there in according to the color code. Normally in our setting we are using 14 and 16 sized NG tube. How to use, take a measurement end of an NG tube while inserting the NG tube? Anybody? How to take the measurement of NG tube? In every patient using same size same measurement for the nasogastric tube insertion. There is a principle is there. Ear canthus to mouth, nose. Okay. Other than that, okay, the tip of the nose to the earlobe, then there from there to the siphisternum. This is the normal measurement of the NG2. How to care a nasogastric tube means perform hand hygiene before going to feed the patient. Give Fowler's or semi-Fowler's position before feeding to avoid aspiration. Prevent air entry in the tube by pinching it, and aspirate and make sure that the tube is in the stomach. If more than 50 ml, skip the feed. Sometimes we have to take the give a proper position, aspirate some content. If the content is there, that is coming to some fluid, means you have to that the position of the NG tube is in proper position. Reinsert the aspirated fluid and feed the patient. Otherwise, if the air particles is coming out, means it is indicated that the tube is in the lungs. Food items is thoroughly grinded and filtered. If not, the big particles of food will be obstruct the tube. So remind that the food the quantity of the food will be very less, and it in a adequate adequate solution. It will be added with adequate solution. Every 2 hourly give 200 to 250 ml. About 25 ml of plain water is given before and after the feed to clean the tube. So you have to clean the tube with the 25 ml of water before and after the feeding. Keep the patient same position at least 30 minutes to avoid the aspiration. Provide oral care and keep the lips moist. Change the adhesive periodically to prevent the ulcer formation. Everybody know the NG tube is fixed with the adhesive tape in the bridge of the nose. So you have to remove in every 2 days. So otherwise it will leads to the ulceration in the particular area. The catheter care video is there. You can watch that.
Thank you, Sister Sreedevi, for the wonderful session. Anybody have any doubts? I know we all nurses, we all know that, but this is very, very important. But within the hospital, patient is in the hospital, we all are there. We can able to take care of the patient, but when they go home, the primary caregiver is the caretaker. So we need to teach the patient caregivers. Without caregiver support, we can't do anything. So that is very, very important. That's why we teach the home remedies also. And when they go home, how to take care of the patients. So these all things you can able to teach to them also. Any doubts? Anybody? If you don't have any questions, we can move on to the case presentation.
So today's case presentation will be taken by Sunita Kumari. So can you hear me?
Yes, ma'am.
So can I share the PPT?
Yes, ma'am. My patient is male patient, which is 75-year-old, diagnosis carcinoma esophagus. Complaints are dysphagia, odonophagia, breathing difficulties, hoarseness of speech, weight loss, loss of appetite, severe anemia, dehydration, lethargy, swelling in neck region, hair loss, sore throat. Patient presented with the complaint of dysphagia 3 years ago in journal OPD with light weakness, small swelling in lateral neck region. Patients had history of chronic smokers. Ma'am, I can't see. 30 years, a bundle in a day, along with the weekly alcohol consumer of approx 500 ml from past 30 years. Swelling was increased in size gradually since 2 years and also weight loss with severe anemia. His HB is 6.7 gram. Loss of appetite for which patient took treatment from PJMS Rohtak, for which patient was diagnosed with carcinoma esophagus stage 4, for which patient was given several cycles of chemotherapy and radiotherapy. Release happens since last year. Sorry, ma'am, I can't see. Last year, patients again developing sign and symptoms associated with carcinoma esophagus, for which patients again admitted to PJMS Rohtak in ENT department. On examination, well-defined swelling of approx 3 cm to 5 cm, 4 cm present in midline region of neck. Pallor was present with severe weight loss. Yes, ma'am.
You can continue.
Cream in consistency, non-tender, no arrhythmia was present, non-fluent, sunken eyes, dehydrated look, dry lips, cracked lips at the angle of mouth, flaky skin. Routine blood investigations like CBC, LFT, KFT, PTINR, RBS, serum electrolytes, thyroid profile, and other specific investigations like associated tumor markers, radiological investigations like X-ray, barium meal, barium swallow, USG neck, endoscopy, MRI, invasive investigations, endoscopic biopsy. Treatment chemotherapy drugs like oxyplatin 5, fluoro. Ma'am, I have some problems. Okay, now I can see.
Okay.
Fluoroxyl, ciplectin, inoctane, other symptomatic treatment drug like PCM infusion, antiemetic like ondansetron, apretant, IV fluids, blood transfusion. A variety of coping mechanisms are needed for cancer patients to live successfully with cancer. A cancer patient has to live with the various stress like loss of body functions, loss of self-esteem, and other symptoms like pain, nausea, vomiting, anorexia, generalized weakness, loss of body weight. And also he has deal with the stress like isolation, fear of death, cognitive impairment. Next, a coping mechanism defined as unconscious skills acquired consciously by patient to bring relief and adjust with reality. There are various coping styles like rational inquiry, seek more information, get guidance. Second, mutually share concern and talk to other people. Affect reversal, laugh it off, make light of situation. For displacement, keep busy, do other things. Impulsive, do something reckless or impractical. Disengagement, withdraw into isolation, get away. Projection, blame someone or something else. A good coping mechanism is necessary and has characteristics like conference reality, consider alternatives, avoid excessive denials, communicative openly with others, self-reliant but accept help when offered, make use of available resources, flexible, realistically hopeful about described patient is being consulted with all the good coping mechanism and patient is responding well. Accepting really is being realistic, hopeful regarding his condition and managing his daily day-to-day activity well. Patient is currently under various chemotherapeutic agents prescribed by the physician like cisplatin, Renoctin, uh, fluorosil, and various other drugs like aldosterone and painkillers, IV fluids. Patient is attending regular session of radiotherapy at PGIMS Rohtak. Palliative means to lessen without curing. Main concern of nursing care in palliative management requires knowing your patient, listening to their story and understanding like values and preferences, showing empathy and responding to emotion are essential features. The goal of palliative care to improve quality of life throughout the course of a serious illness. Focus is on symptoms management, advanced care planning, psychological support, and relief of suffering. All of these must be included along with the ongoing treatment to provide a good quality care to patients so that patient can live a stress-free life and help them to comfort their illness better. Patient summary. Patient age 75 years male presenting with sign and symptom of esophageal carcinoma progressed to stage 4 since 3 years, currently under treatment in PGIMS Rohtak, now being given palliative care and counseled along with family members regarding all the psychological aspects regarding palliative care. Discussion points. What are the components of palliative care and its importance in terminally ill patients? What is the importance of psychosocial aspects in palliative care? Thank you, ma'am. Ma'am, I want to say sorry. My patient got expired now 15 days ago.
Thank you, Sister Sunita, for the wonderful patient story. Anyway, I am so sad to hear that the patient is passed away, no more. Anyway, we can discuss this patient because
Okay.
I would like to know about the physical problem. What are the physical problems? What are the psychosocial issues? And what are the spiritual issues? We know the concept of the total, the palliative care concept is a total care. So we need to, whenever you have seen a patient, like even a life-threatening illness or a life-limiting illness, you have to uh, focus on four aspects because physical aspects is also on physical aspects everybody is will take care of taken part because whenever if they have physical problem they will come to the hospital, so we all there for their take care of their physical problems. So we along with that we have to address the psychosocial issues and spiritual issues. So I would like to know from this patient story what are physical problems that the patient was uh, there that
Patient was unable to move freely or he was very weak physically
okay.
and her wife also tired to cope up with his ma'am can I speak in Hindi?
You can you understand? No, no, whatever
Okay,
you know you can speak in English, but we can't
okay ma'am,
understand.
okay ma'am.
Yeah.
because
can
I
able to
little bit
understand.
I'm trying to.
Yeah.
Okay, ma'am. Every time her wife told to him, yeah, in this hospital, I can treat. I can want to treat this hospital and this hospital, or physical issues that appetite, loss of appetite, and he was very weak, or rough skin, and scar marks on her face and neck region.
Okay.
He feel very shy.
Okay. So there are a lot of physical
Or,
problems.
ma'am, excuse me, ma'am.
Yeah.
Her sons and his wife, his son and his wife, always telling to him because of his smoking habits and alcoholism, blaming to him about that habits.
Oh, okay. So that's very bad because if someone's developed this kind of disease after their maybe because of bad habits, always the family members will be blaming. So that will be affecting them a lot because they will be uh, it will be affecting emotionally because of me, because of my bad habit, always there inside his mind. But whenever the relatives blame them again, he will rethink, and yeah, and also he is not able to that cure the disease. No, he that medical persons are not able to cure the disease. This is cancer. So day by day the health condition is deteriorating, and lot of problems will be there, and other psychosocial issues. So these all things will be affecting the patients emotionally. So um, if they have a psychosocial issues, I always said, like, if they have a psychosocial issues, definitely the physical pain, distress will increase, because if they have a physical pain, uh, like 5 out of 10 pain will be there. But if other than that, if they have a psychosocial issues, the physical intensity, the pain intensity will increase because of the psychosocial issues and spiritual issues. So what we do is we can do the individual conversation with the with the patient and the family. So you have to listen the patient, as and also you have to listen the family. So if you have to make them understand that why you are blaming this time. So we don't need no point. If you blame to these patients, you can just rethink, and again he will worry. So because of
Yes.
that, they will not get anything. So they will not get anything because you can. So if you blame something, you after that you will not get anything. You can able to suffer him emotionally, because you can able to make him suffer emotionally. So that thing you have to convey. You have to listen the family members, the relatives' emotions. We know because of his bad habits, the patients got this disease. But at the same time, you have to see, you have to care with to the patient with an empathetic mind, and you have to listen the family members problems, and you have to tell them the things, what all things you can do, what all things you don't want to do that time. So unfortunately this patient is no more. Anyway, whenever you see this kind of patient, you have to keep it in mind all the time. So the relatives, if they have some kind of bad habits there, you usually the relatives and neighbors come there and blame them. So that will be affecting the patient emotionally. At that time, if you blame, nothing is that you will nothing you will get, no. you can able to increase his emotional sufferings. So that all things you have to keep it in mind. What was the main concern? Sunita ma'am,
Uh,
what was his main concern?
Main concerns was my main concern was कि my patients uh, comfortable feel comfortable in his life and his family with his family friends and
Yeah,
they
yeah, definitely our aim of the end of life care is to maximize the comfort level. At the dying process, we can able to make the dying process as much comfort as much as we can. So try to control their symptoms, especially if there is a death rattle there, control that death rattle. So these kind of things, if there is a delirium confusion there, you can able to control the confusion or restlessness. So these kind of things we can able to reduce so that the death journey is smooth. So that is the main aim of end of life care and palliative care. So uh, that is one of the objective. Always you have to keep it in mind. But if you can give palliative care along with the curative treatment, then the journey is a little smooth, because at a point of time the curative treatment doctor like oncologist will tell them like nothing more we can do. At the same time, they are in palliative care, no? So they have some feeling that the palliative care team are there to take care of me well. So that kind of relation, the thing will be there. So if possible, you can start palliative care along with the curative treatment. Okay. So definitely, we already discussed about the components of palliative care. The components of palliative care is physical, social, emotional, and spiritual. And the psychosocial aspects also very, very important. You have to explore the psychosocial issues. If you they want to explore the psychosocial issues, the nurses need a good listening skills. We already know that the communication skills. Whenever you communicate with the patient and family, always you have to understand their non-verbal expressions, because we always use that more non-verbal language while we communicate. So if you that make you some non-verbal expressions, that will be affecting the patient emotionally, so you don't give a emotional harm to the patients because of your non-verbal expressions. Always you try to listen their problems and explore their problems, and once you listen their problems, definitely they can able to explore. If they are able to explore their problems, they will get a mental relief. So if you want to put it across the team, definitely you have to take a consent and put it across to the doctors and team, and give a proper support. You can help support from the doctors also. So we are focusing on the total care. So at the same time, you have to think about the family members also. We need to listen to the family members concerns also. Here this is the bad habit, but sometimes in end of life care patients, because the family, the caregiver are losing their going to lose their in end of life, losing their loved ones. So that will be affecting the family members emotionally. So we have to listen their emotions also. Okay. At the same time, you have to think about after death also, you have to think about the bereavement visit. Or if you are not able to visit the patients, you at least make a phone call, and you can just listen. Or how are they going to do anything, any problems, any psychosocial issues. So we know what are the stages of grief. So if they 6 months griefs are normal, the stages are not, the grief period 6 months is normal. But if there is more than 6 months, you have to get attention, give attention to the doctors, and give sometimes the patient family need a proper counseling or a need to take a treatment from the psychiatrist. So that all things you have to think about. You have to think about if the patient is in end of life care. Always you can do a bereavement visit if possible. Otherwise, you can do the phone call and see. Okay, thank you. We can wind up. If you have any questions, anybody have any
Thank you, ma'am.
questions? Any questions or comments? No. So I hope so today's class is clear to everyone. Thank you. So Ashley, wind up.
Thank you, Sister Sreedevi, for the wonderful session on basic nursing issues. And thank you, Shiba ma'am, for joining us. And thank you, all others, for joining the session. And see you all in the next session. Till then, bye and take care.
Bye bye.